I started this show more than a decade ago was to inspire and empower my viewers. And I've always felt the best way to do that is to lead by example. Sometimes that means sharing something very personal, like tonight. I'm one of more than 10 million Americans living with macular degeneration. Oh, there's a lot to learn about the disease, but the first step is getting checked. Join me for a consultation and a procedure that I hope will help take away the fear of the unknown. Gee, I suffer from macular degeneration, but maybe our viewers, some of them, don't know what it is. So tell us.
Well, I think to go over what macular degeneration is, Suzanne, we have to sort of understand how the eye works a little bit. And the way the eye works is in the front of the eye there's a lens focusing system which focuses what we look at onto the back of the eye to a tissue called the retina. And in the center of the retina there's a little area we call the macula. And when the macula goes into a dysfunctional mode, we call that macular degeneration. And macular degeneration is divided into two different types. The dry type is kind of this very slow, progressive problem which builds up, causing more dysfunction and more deterioration of the tissue. And after time, those patients become at a higher risk, since there's a deterioration in the tissue, for abnormal changes to occur and blood vessels to grow in. And these are very fragile vessels and they can break and bleed, and that causes a release of fluid and a swelling in the retina, and that's called wet macular degeneration.
Well, what are the risk factors associated with the problem?
The major risk factor is age. When people in their 50s, probably about 2% of the population has beginning macular degeneration. By the time you get into your 70s, about 30%. Hereditary is another risk factor. If you have a family member who has macular degeneration, there's a higher incidence that you may get it.
Well, what are the symptoms that we should be looking for?
The symptoms vary, but anybody who has blurred central vision should have a complete eye exam.
So the most common problem is the loss of some eyesight.
Central eyesight, yes. Reading, recognizing faces, not being able to see the print on TV.
Are there preventive measures to guard against macular degeneration?
It's important to have eye examinations to see if you have risk factors in the tissue in the macula. People who have hypertension should be treated. If you have high cholesterol, that should be treated. If you smoke, you shouldn't smoke.
What treatments are available?
Well, for the wet macular degeneration, we have some treatments. But for the dry macular degeneration, we don't have many treatments. If the doctor feels that your dry macular degeneration is very, very advanced and that you're at high risk to convert, then you would probably be asked to take vitamins. That's about it. For wet macular degeneration, we use medicines that we actually inject into the cavity of the eye.
Where do you put that, and how do you get into the eye?
So the eye is a hollow structure, and it's filled with a gel-like fluid. So there is an area of the eye behind the colored part of the eye where there's no blood vessels, and it's very easy to go through that area with a needle with low risk and put the medicine right into the cavity so that it can then bathe the retina that's at risk.
Before I had the procedure done, I went through a series of routine tests. My eye pressure was checked, A scan of the retina was done and reviewed by Dr. Federman. Then it was on to the injection.
Suzanne, I want you to prepare yourself for the injection. I'm going to anesthetize your eye, and then I'm going to sterilize it, and then I'm going to prepare the medicine. Okay? Look way up above your head.
Did that go in?
Yes, and you didn't feel it because you're anesthetized. I want you to look down at your feet. Keep looking down. Keep looking down. Okay. You did great.
It's done?
It's done.
In less than a second.
Less than a second.
Thank you. Thank you. One of the ways I deal with pain, or the fear of pain, is an old trick from my acting days. Instead of thinking to myself, oh no, this is going to hurt, I think of it mainly as simply a feeling, not a good one, not a bad one, just a feeling. I try to remove myself from the situation and look at it more objectively. That seems to work for me. For more information, go to macular.org.